The kind of work that we do here is really unique.
It's unlike any other training program that you can go to.
I think the most important aspect of the fellowship is people have an opportunity to go in many different directions.
The program growth has been amazing. The opportunities are unlimited.
I am Maria Torella Carney. I'm a physician and I'm the chief of the Division of Geriatrics and Palliative Medicine at Northwell Health. We advocate, train, educate how to care for the most vulnerable patient population. Because our division is both geriatrics and palliative medicine, we see a great spectrum of care.
Northwell is special because it's the biggest healthcare system in all of New York State, stretching not only across all Long Island, but across New York City and even to Westchester. And as a division of geriatrics, we're unique because we touch different parts of that health system.
We utilize an interdisciplinary team, which includes physicians, advanced care practitioners, social workers, nurses, to provide the right care that helps patients, their families, their caregivers.
The growth of palliative care and geriatrics throughout the system has really accelerated over the last decade. Patients and families really need support and help navigating both physical symptoms, emotional symptoms, and challenges throughout their journey with advanced illness.
Here at Northwell, we have two fellowships. We have the Fellowship of Geriatric Medicine, which is a one-year clinical fellowship, and then we also have Hospice and Palliative Medicine Fellowship, which is also a one-year fellowship.
Every fellow who's come to work with me has stated outright that this is different than they've ever expected it to experience.
The beauty of being a fellow with Northwell Health and the Zucker School of Medicine is that you have a diverse experience. We have North Shore University Hospital, we have Long Island Jewish Medical Center, and we have Lenox Hill in Manhattan.
This is New York. The population is very diverse. We see folks from all over the world.
And it really gives us a good scope of practice. I think it prepares us for interacting with a lot of different types of patients and families.
Trainees have an opportunity to engage in all forms of research through their training and just an incredible amount of services that you can really participate in and engage in.
The Geriatrics Fellowship Program is a large program. We have 8 fellowship slots. It's a program that has a huge amount of resources in terms of materials for learning.
There's a variety of different geriatric training programs, but what makes us unique is just how many different sites of care that you'll interact with.
So they spend time in ambulatory care, they spend time in long-term care, they go into patients' homes.
So you're able to see all different types of clinical training sites, but on top of the clinical training, the interaction that you're going to have with leaders in healthcare.
And because the system is so large, it also offers opportunity for community outreach, for engaging with not just the patients themselves, but their family, their wider support networks.
The Palliative Medicine Fellowship has 6 fellows. We have unique opportunities that don't exist in a lot of other places, from, again, the community practice to specific programs like the heart transplant program, trauma program, neurosurgery.
Our goal is really to provide an excellent educational opportunity for our fellows moving forward within their careers and also excelling within the field of palliative medicine.
It wasn't until my 4th year of medical school that I rotated with palliative medicine, and I was sort of intrigued by the field that I really didn't know anything about. And I realized right away that that was really my calling.
We have a dedicated unit for palliative care over at our North Shore campus. It's a 10-bed unit. The division is very supportive of new ideas and innovation.
So when the chair of the Division of Geriatrics and Palliative Care met with me early in the year and proposed to me the option of being able to develop a program, the thought of being housed in oncology but representing palliative care and really trying to change the status quo, change what people's perceptions are of palliative care, that was enticing for me.
I think our resources in terms of our partnerships with the Feinstein Institute as well as faculty within the division really will enhance their careers moving on within any sort of research path that they want to go down.
We have a Center for Health Innovations and Outcomes Research.
We train medical students, physician assistants, pharmacy students, fellows in other programs, internal medicine residents and residents from other programs. So the fellows have an enormous opportunity to develop their skills as educators. Research, policy, education, there's no limit to what this program can expose you to.
I would say as a fellow, the quality of life is very good. I felt actually excited to go to work. I love the team that I work with.
What I love most about working with the fellows is just watching them grow.
I found my voice, I found my confidence.
What makes it unique is the support that you have through the different members of the team. You're never alone, they're always by your side.
We have shared a lot of tears together as a work family. And so those sorts of bonds are irreplaceable.
I think if you're considering applying to geriatrics and palliative care, that this is just an incredible place to receive your training. So from clinical care, academics, and research, it is all really expanding quite a bit.
The perfect candidate is somebody who is ambitious, somebody who is interested in coming to a large academic center.
You know, we have such a need in geriatrics and palliative medicine, and we'll never train enough physicians to provide all the care that should be provided to the older adult population.
I think the fellows at different points, everybody reaches this, get this light bulb. Wow, this is why I've done this, to impact and change healthcare for the future.
So thank you.
Thank you.
Thank you.
Thank you.
Thank you for choosing geriatrics and palliative medicine as a career pathway. The need is so great, and we hope that you'll consider us for your training experience.